we started the Medical Directors Masterclasses back in September 2017, and we did so in partnership with the Leadership Academy of the East of England, and also the East of England's Medical Directors Forum.
It's always really good when a plan comes together, isn't it? We didn't really know when we began the discussions about setting up the Medical Directors Network Forum, really what the impact might be. But actually it's been a real pleasure and a privilege to work with Dr. Roger Hall, Medical Director, and Helen Oliver, Director of Network Leadership at the Academic Health Science Network.
We identified that the need was there from kind of discussions with lots of different stakeholders at the beginning of that year, where people were saying, look, medical directors are really key to innovation, but we're not really doing a lot to support them as a group of peers.
We've been able to engage some really good speakers to come to the masterclasses. For example, Professor Stephen Powis, who actually asked all the participants there for their views and contributions about the NHS 10-year plan. And actually he got asked a lot of difficult questions as well. So there's always that opportunity for some really good discussion in the room. One of the other speakers who came was Caroline Alexander. She's Director of Nursing at Barts Hospital in London. And again, just the recognition that we need to very much work as a multidisciplinary team. Caroline was able to share her perspectives on leading at exec level and actually taking the team with you.
One of the aims of the Medical Director Masterclasses was to support the medical directors across the region to convene more regularly as a community of peers in a way and in a place which was neutral and safe, and they could learn together from one another's experiences.
In addition to the masterclasses, we've also been able to give the medical directors access to coaching, mentoring, and also the opportunity to undertake their own 360 through the healthcare leadership model. But at the end of the day, actually, I think the power of the network and the conversations that they've had has been one of the most important things.
I'm a medical director and I'm a member of the East of England Medical Directors Forum. We as a group decided we would like some leadership development for ourselves as medical directors and our upcoming talent, associate and deputy medical directors, and in discussion with the Eastern Academic Health Science Network, they came up with this programme.
My motivations were really about how other people were working as medical directors in their organisations.
I'm very new to the role as medical director when the masterclasses were talked about and introduced. It's away from my hospital setting where you're in demand all the time. So it's that sort of safety of being away.
I think it's nice to hook an educational element onto a networking forum, sharing best practice, our experience of it, as well as what could be done.
This came through and I thought, gosh, this is something that would set me up for in the new role of a medical director. That part has really helped me.
I think it's about talent management.
There's two aspects. There's the fact that we come together as medical directors and interact, and then we have the speaker. There's a speaker who leads a discussion. We've had a mix between some theory-led ones from a theory expert, and then to contrast that, we've had senior experienced clinical leaders who are sharing their top tips, their lessons from experience.
The first one I attended, yes, was around team working, and I found that really useful.
It was one of the sessions led by the Judge Business School, and how easy it is to create a team in what you think is your own image, and that actually a better team is taking the diversity.
So one of the talks we had was about influencing, and it was really inspirational.
Influencing is a technique that you really need to learn. The time of organisational supremacy is going, and collaborative work, collaborative leadership beyond organisations is where it's all happening.
It's how to be a charismatic leader, how to make people want to do the right thing.
It did some group working, which actually, as a new group really made us gel together.
So latterly, the talks have been more about individuals' perspectives and their leadership journey.
One of the key things for me is to hear from someone who's actually done that role.
How they got to that position, the setbacks they experienced, how they picked themselves up.
They've all been really interesting, and I've really benefited from them.
Being a medical director, being a clinical leader can be a lonely place. You're often the only clinical leader.
It can be a very lonely job.
You won't have anyone in exactly the same position in your trust to share all your confidences with.
You're there in the organisation as the expert, so if you're not sure about something, who do you ask?
So it's quite nice to get external opinions, bounce ideas off people and be in a supportive environment. There are Chatham House rules. We're all in a similar position.
So you've got such a wealth of experience there that it's a great way to learn and share.
To know that I'm not the only one who may be having problems. I've got other colleagues who are having the same feelings or the same thoughts.
I think it's quite a good mutually supportive network, and that is valuable. People do come. They don't have to, but they come.
I've managed to adapt those principles that I've learned through the masterclass to help adapt to some of those difficult situations, difficult conversations.
One thing I'm definitely enacting is taking more of a coach mentor role.
The organisation has to create some culture and values and vision which you can then model.
There's certainly been greater familiarity between medical directors, greater willingness to approach each other for advice. I don't think that would have happened quite that way without this networking.
So that brings us closer together because we're developing a common history.